to save your life was only $1,000. The companies before us were actually just giving it away almost.
That was Martin Shkreli last week, trying to defend his 5,000% increase in the price of an essential drug. This week, it's Valeant Pharmaceuticals, a Quebec-based company under fire for hiking the price of two rare heart drugs. Valeant is using precisely the same business model as Martin Shkreli, wrote a group of U.S. Democrats, trying to force Valeant officials to turn over documents and testify before a congressional committee. It's part of a war on drug prices launched by U.S. presidential candidate Bernie Sanders.
That enough is enough. The greed of the pharmaceutical industry is killing Americans and making many of them much sicker than they otherwise would have been. It has got to stop.
Sanders has been pushing the issue for months.
I mean, it's disgraceful.
But it took comments from Hillary Clinton to make it a front-page political story in the U.S.
We're going to start holding the drug companies accountable to drive down the prices.
At issue today are two rarely used heart drugs, Nitropres and Isuprel. The rights to the drugs have changed hands twice in 3 years, and each time the U.S. price went up by hundreds of dollars. Valeant has built an empire by buying the rights to existing drugs and increasing the price. Ask liver specialist Eve Roberts.
I am still feeling quite traumatized by what happened to my patients.
In 2013, Valeant jacked up the Canadian price of a life-saving liver drug by about $148,000 a year, almost overnight.
So to see these prices rise capriciously and suddenly is just intolerable for these patients.
In the end, Valeant backed down and reversed that price hike. The company has not commented on the new controversy.
I think we're at a point now where governments are seriously considering what they can do to keep prices in check.
UBC professor Steve Morgan is writing a commentary about what he believes is a tipping point, as more and more drug companies set prices at what they think the market will bear.
Now it's not at all uncommon to see manufacturers charging hundreds of thousands of dollars per patient per year.
It's not clear what policy mechanism governments could use to control prices, but what seems to work so far is public shaming, which has triggered two very public price reversals in the last week alone. Kelly Crow, CBC News, Toronto.